Hello, my name's David Evans. I'm an intensive care specialist at the Royal Adelaide Hospital. And I'll be talking about what it was like looking after the COVID patients. These patients, who, when they came to intensive care, were very unwell, often needing a lot of support with oxygen therapy, a number of which needed artificial ventilation. It was different caring for the COVID patients because we needed to be very careful about using personal protective equipment. We worked in a team-based fashion, often people using another staff member as a spotter as we were putting on, and particularly the more dangerous procedure of doffing our PPE. It became much more serious. It was no longer a drill or a practice effort when we knew the patients were COVID positive.
My name's Andrew. I'm one of the clinical nurses in the intensive care unit at the Royal Adelaide Hospital. I was specifically one of the level 2s working in the COVID pod. When we first started, it was very challenging, very emotionally draining, as well as physically challenging, because obviously wearing all the PPE is quite warm, hot, and you sweat a lot while you're wearing it. Our colleagues are now still, I think we're at that, because we're between waves and we've had the opportunity to sit down and take that collective breath. I think that a lot of us are taking in what's actually happened, what we've been a party to, and what our roles were. Some of us are very proud of what we've been able to achieve. A lot of us are very emotional, though, in regards to the cost that the toll that this disease has actually had.
Because families couldn't visit the COVID patients because they were either in isolation themselves or they were at risk of getting COVID themselves, we had to come up with new ways of communicating with the families. Normally in intensive care, the family spent considerable time at the bedside, and this wasn't possible. We came up with a number of innovative strategies, which included daily or twice daily phone calls to the families, updating them on the patient's condition, and also the use of video calling devices to allow families to see what was going on in the intensive care unit.
So when the patients first were admitted to the intensive care unit, they came down self-ventilating and awake. No patient was admitted intubated, and so we had the opportunity of actually getting to know our patients, learning about them and their situation, which brought them into hospital. We actually got the opportunity to sort of sit with them and help them with their fears that they obviously were going through with the diagnosis of a corona and then progression to the COVID-19 pneumonia. We had the opportunity of meeting their families later on in the admissions through video chats, but we would always phone them up first thing in the morning. We'd give them an update of how they were. We've had to change some of the ways that we've done things. We've had to not let family members in to visit, not let family members be there at the end of life, and so that's been very, very hard because it sort of goes against what we do as nurses. We're always very family orientated as well as the patient, and so to actually step outside of what would be a normal thing for us has been very hard to take on board sometimes.
We had external support provided by CALHN in the form of a psychologist. We had enormous support from the rest of the hospital, and that was greatly appreciated. We had letters sent through from school children that had written to frontline healthcare workers, and those letters were greatly appreciated.
I think the experience has just simply made me more heightened in my role. Firstly, we do look after a lot of infectious patients that come into the intensive care unit, people that might have tuberculosis or other communicable diseases. We have a way of caring for them where we always make sure that we're safe. What this has sort of brought out in us as a team and me personally is just a heightened sense of that, and so a much more vigilant approach to the way that we would care for these specific patients. With that, I feel that we'll probably take that on and implement that in our care as we move forward.
Working in the COVID pod provided a strong sense of teamwork and camaraderie. Everyone worked together because we knew that these patients were very sick and we wanted to get them the best possible outcomes.
I think one of the other greatest emotions that I have is the feeling of pride working with such an amazing team here at the Royal Adelaide Hospital's intensive care unit. So what I would say to the community is that, like, as an intensive care nurse that's been at the coalface here, I'm very proud of my state and I'm very proud of my country for being able to socially isolate and do what really needed to be done. It was a horrible thing that we've had to do, to remove ourselves from our normal lives, to remove ourselves from our family and friends and what we would consider a normal day. We've done an amazing job to the point where we can sit back here in Australia and South Australia and look across the rest of the world as it still struggles to fight this condition, and we can say that we're in a really great place. But do not undo the good that we've done. Do not rush to try to bring ourselves back to a normal just for the sake of getting back to a normal and then risk reinfection. It will only take one before it could potentially spread to many. So just listen to the leaders, continue to self-isolate where it is, and as they slowly roll things back, just take your time and don't rush to go back to normal.